There are 33 million people worldwide who are currently HIV positive. More than 2 out of 3 adults and 90% of children with AIDS live in sub-Saharan Africa. Over 75% of AIDS death in 2007 occurred in this region. It is estimated that there are over 12 million AIDS orphans in Africa. Although there are numerous factors in the spread of HIV/AIDS, it is largely recognized as a disease of poverty, hitting hardest where people are marginalized and suffering economic hardship. Each day, 6,800 people become infected with HIV, and over 5,700 people die from AIDS, largely due to inadequate access to prevention and treatment services. Perhaps the greatest tragedy of the AIDS pandemic is that it is not inevitable. It is a problem with a solution. We know what works, what needs to be done. It is now a matter of doing it. Poverty is one of the root causes of the spread of HIV/AIDS. Nowhere is the devastating impact of HIV and AIDS felt more strongly and more irreversibly than in poor households and communities. The poor and marginalized are least able to deal with the impact of HIV/AIDS. They are too poor to take preventative measures and are unable to afford treatment once infected. The poor are politically and socially excluded from HIV-focused programs, further perpetuating the cyclical nature of poverty and infection. HIV can be passed from mother to child through breast milk, but most families are too poor to afford formula and clean water, leaving few options. The HIV epidemic has its origins in African poverty, and unless and until poverty is reduced, there will be little progress either with reducing transmission of the virus or an enhanced capacity to cope with its socio-economic consequences. It follows that sustained human development is essential for any effective response to the epidemic in Africa. MOCASO offers care and support for women and children infected and affected by HIV/AIDS through education, counseling, and economic empowerment.
My name is Joyce. I'm the program coordinator of Mother Child Disease Support Organization. I've lived with HIV for now 19 years. I was a mother, but now no longer a mother because God has taken all my children away. I had 2 children. My husband passed away in 1985, and now I'm living alone. I am the initiator of Mother Child Disease Support Organization, and why I decided we start this organization was because I realized we had these problems, and by that time, that was back in 1998, was a time when there was a lot of stigma. People were really fearing about us who are HIV infected, and we decided to come together.
So we decided to come together so that we empower each other, and that is how MOCASO started.
Members gain financial independence through IGAs, entrepreneurship skills, and access to microloans. MOCASO provides home-based care, food and material distribution, and a voice for those who are marginalized by stigma. MOCASO addresses the prevailing attitudes and stigma against HIV/AIDS and teaches responsible behavior to women and children, especially orphans and vulnerable children. Network collaboration and fundraising are also important components of economic empowerment.
We do some visits, home visits, like she said. We do counseling. There are those people who come here when they are very desperate to have post-test clubs, whereby we have a group of those who are, who have come out public, and they come together, they share once in a month. They come together, talk about themselves, the problems they are encountering. We also have food and material distribution.
MOCASO is involved in various IGAs.
We do tie and dye, which is very good. Tie and dye has really helped us. we make some tablecloths out of the tie and dye we make. We have very good tie dyes. We make bed sheets. We make aprons. We make those simple things, and people buy from us. And we are also encouraging other people, if they can also learn through the skills, and they can do it on their own in their homes. And I also want to show other people how these things are working. It's not only for myself. I want also to benefit others.
We are doing it, and this has really empowered us because we have been able to pay for the rent. We have been able to pay for our food, and for those of us who we are doing commercial sex have even stopped because we realized if we continue exposing ourselves to infections, we are likely to die fast. But for us women, we want to live for our children, we want to live long, and we have hope. So that is what MOCASO has benefited us, and we are hoping that it will continue because we are trying to expose ourselves and even market ourselves on what we are doing. We have realized the work we are doing is very important because it's the only solution now that people are not having so many problems with the antiretroviral drugs. Those of us in MOCASO are antiretroviral drugs, and we are able to live the normal life like anybody else. The only thing we need to do is to work, and through what we are doing is really doing good for us.
Though we no longer cry, those days are the times we used to cry. But nowadays, there is hope. It has changed. We have gathered kind of an energy. We are strengthened. Thank you very much. Accept our thanks.